Hey there, I'm Dr. Berrett. I'm the owner of Imago Medical. We specialize in male enhancement, and I'm making this video as kind of a male enhancement 101. It is really hard to find out information on this. It's like an Alice in Wonderland experience. Like, you start with the door, then you're falling down a hole, now you're at some tea party where everybody's crazy. It's just hard. So figured we're going to make a series of videos kind of giving you all the information about this. This first one is kind of the crash course 101 of male enhancement. So first of all, if you're looking into this, you are normal. You are a guy with a pulse, because all of us want to be bigger, right? 99.9% of the guys that do this procedure are normal, average size guys. 70% are married with kids, because having kids, anatomical change, not as interested, but we need intimacy to connect. So it's been pretty cool over the past 4 years and 1,000 procedures that we've done. It's been cool to see kind of the improvement in men's confidence to the improvement in the intimacy for couples. It's a good thing. So it's normal to look into this. Another thing that a lot of guys get misled by is that length is what's really important. Anatomically, length is not doing anything for your partner. It is circumference that stretches and contacts the tissues that matters. Okay, let me prove that. So let's say I have a guy that is the average, this is 5-inch circumference. Okay, let's say this guy's 8 inches long. Then I have a guy that's an average 5.5 inches long, but he has a 6-inch circumference. Who do you think is going to give a better experience to their partner? Right? Circumference or girth is what matters. And that's a good thing, because that's what male enhancement can really do. The challenge with male enhancement is anatomically, underneath the skin of the shaft, it's just a big tube of tendon full of blood vessels. There's a corpus cavernosa. It is a very tough structure. When it gets filled with blood, you get erect. That's why it feels hard, because it's a tube of tendon. You're not going to make that anatomically change. Pills, pumps, P-shots, they'll get you really engorged with some great blood for a few months, but they're not going to anatomically change that tube. So male enhancement really focuses on the outer layer of skin. Now, lots of people want length, and that's totally understandable. Realistically, as far as getting more length, you have either a ligament cut or you have stretching devices, and they both do about the same thing. So go with the stretching device. Is something you wear a certain amount of hours a day for about 4 or 5 months, and if you can get statistically a 1/2 inch to 3/4 inch in length, any more than that's going to start screwing up your function. Mayo Clinic has a good one. So that's what you can do for length, but that's about it. But circumference is what matters, and that's where the options come in. Okay, so when you're looking at male enhancement, you're looking at things that increase the girth. That pretty much puts you into one of two areas, either surgical or filler. Surgery is invasive, implants, fat grafting, which the fat always gets piled at the bottom, and our procedure can fix that if you've had that and have issues from that. But there's a surgical option, which I think are all unnecessary. Then there's filler, which, we use filler. It is the preferred way. So this procedure, we use PMMA. It's a permanent filler. It's been an FDA-approved facial filler for 20 years. It's very safe. It's very well known. It's very effective. The way that this works is when we inject the filler into the skin of the shaft and the head, and we can also do the scrotum for kind of that full package look, which I recommend. But when we inject the PMMA into the skin, we're just putting microscopic droplets of PMMA in the skin. And then your body's natural reaction is to wall these droplets off with more connective tissue called collagen. So basically, the outer layer of skin of your shaft gets thicker with natural connective tissue increase. That's how this works in the face. Women get in their cheeks and their jaw, adds more volume, makes them look younger again, right? So for this procedure, it works very well. It's natural collagen, so it's going to look and feel like your normal skin. Somebody could do surgery and cut your skin open. They're just going to see connective tissue. The filler is microscopic, okay? It's in there microscopically, and because PMMA just sits there, it doesn't break down. Your body just keeps remodeling that collagen, and it is a permanent procedure. The average gain is 3/4 inch in circumference per procedure, which is awesome. Some guys get a little more, some guys get a little less. I'd say you have a 80% chance of getting a 3/4 inch growth at least. And like I said, most married couples, or most guys that do this, are married. This procedure's been around for about 13 years, mainly with silicone and some PMMA. And out of like the 40,000 couples that have done this procedure, what we found is that, the average circumference, erect circumference, is 4 to 5 inches. What we found is 6 to 6.5 inches is where couples tend to really be happy with things. That's also the most commonly purchased like toy sizes. So we kind of know what works. Everybody's individual, but basically 90% of guys come back for a second procedure. They love the growth off the first, and they want to get another gain. They want to hit that 1.25, 1.5 inch overall growth, which you should get from 2 procedures if your body's able to make collagen well, which most people do. If you want to be bigger, if you want to increase your confidence, if you want to increase your intimacy, shoot us a text, set up a phone consult. If you're out of state, we tend to cover flights, or at least a certain amount of the flight. We're a 20-minute Uber from the airport. It is a fly in, fly out, 2-hour in-office procedure, pretty simple. So we specialize in this for 4 years. Trust me, we get it. We will take good care of you. So hope to see you soon. Thanks.